Okay, sorry about that again. Seems like it's a bit of a jinx today, and I'm not sure why, because we've pretty much had great connection through this whole few weeks, and suddenly it seems to be getting interrupted quite badly. But I think everybody's joining back, and now I've connected from my mobile phone, and let's hope that this time the signal stays better. And I can't text Steven, so let's hope that he joins back in. But we were just going to discuss about medical versus surgical rhinoplasty, how to make a choice. And Steven is one of the authorities on this, having done a lot of studies and written lots of papers about this. So let's wait and watch. Where is Steven? He should be joining us shortly. The moment he joins, we'll be able to get him back to talking to us about the medical and the surgical rhinoplasty. And what's interesting about this is it's a very common procedure that's getting picked up these days, where patients are coming in asking for a non-surgical option to get their nose correction done. And we're also seeing that we're having people discussing about what are the safety standards and who exactly can do these procedures and treatments. So let's see where Steven is, because we've not been able to get him to log on yet. Okay, there we go. He's there, and we've got Steven in the house. And we're waiting for him to join.
Hi.
So we're back.
I don't know what's going on, so let's try again.
So you were talking about medical versus surgical rhinoplasty.
Yes. So if you're going to do medical rhinoplasty, there's lots of different types of fillers you can put into the nose, but you have to be very careful because there's a risk with putting filler in the nose, and there's the one risk that we mostly worry about is that if you get a injection into a blood vessel, you can get a permanent scar or maybe even a more catastrophic outcome. There's been few reports, rare, but few reports of even people losing some of their vision. Now it's rare, but it's really important that you see someone who does a lot of these. And it's not a simple procedure to do. It's got to be done particularly well. So one of the things I recommend is that if you're going to undergo a filler rhinoplasty, you see someone who understands the anatomy of the nose very well. And when it's done with, I prefer cannula. Some people use needles, and a cannula is a blunt tip. I believe a cannula is much more difficult to get into a blood vessel. I think it's much safer. That's my opinion, and I'm a strong advocate for doing it that way. Now, there are many colleagues of mine who are very experienced who will use a needle, but I don't like that. So I use a cannula. I have a 5-point technique. If they go on my Instagram, I have it somewhere there under one of my Monday Minutes where I talk about a 5-point technique to getting a fantastic result safely and effectively and immediate. And patients walk out the door and they're thrilled, like, oh my gosh, look at my wonderful nose. Now, if I do this a lot, it can affect the envelope or the skin of the nose. So over a long period of time, it's not good to keep doing it. I may do it one and it lasts a year and then come back, I'll do another one the next year after that. But I really try and encourage people to do a rhinoplasty, which is a surgical procedure. If they're happy with the appearance of the nose with the liquid rhinoplasty, with the filler, I say, let's try a surgical one. And oftentimes I get them to undergo a permanent solution with a rhinoplasty.
Okay, that's the first time I heard someone say that if you do it often, it's not good for the skin envelope, because usually people don't talk about that part. Do you want to elaborate why? Because we have a few plastic surgeons who've logged in today and dermatologists.
So if you do any type of foreign body into the nose over and over again, you start to cause irritation to the deeper dermal structures of the nose, as well as to the vasculature of the nose can be affected. And over time, you'll see when I go into a nose that's had multiple injections, especially if those injections were done superficially, the skin is very different. Even lifting the skin is more difficult. And the same thing happens in a facelift. You know, I go into many facelifts on patients who've had fillers. I can tell if someone's had Sculptra or Radius, because there's definitely a different effect, even if they've had HAs. The skin is tethered down, there's more scarring, there's more fibroblastic activity, so it's harder to lift the planes of the skin. The same thing happens with the nose. But the nose, the vasculature is very precarious. And if it's lifted many times, the skin gets thin and it doesn't heal as well. And also you get this purplish color to the skin sometimes. Now, thicker skin patients do better than thinner skin patients, so they have more tolerance of the fillers. But they tend to not have such dramatic results like the patients with thin skin, where you see the results are fantastic. One area I want to comment where I think that filler rhinoplasty has changed many practices is people who have had previous rhinoplasty, and they may have just a little area where they don't like. And instead of having to go back and do a big surgery, oftentimes you can put a little filler in there.
Mm-hmm.
And it's amazing because sometimes that's all they need, and they get a little bit of fibroblastic activity. It thickens up the skin, and they're done. They don't have to go through another surgery. So I see that as an option, but I strongly recommend you see someone who knows anatomy of this nose, because there's an increased risk to do a filler rhinoplasty and someone who's had a previous rhinoplasty.
Very
So
true.
you have to be very careful. And in my office, I have 5 injectors, and I think I'm the only one who does the nose, because either they're scared of doing it, or we don't have our extended providers like our nurses and physician assistants. We don't allow them to treat the nose because the risk is much higher there for getting a bad outcome.
That's true. It's the same in India. I think there's only 5 or 6 of us who actually inject noses often, like periodically. Most people shy away from it, and we don't even train them anymore on medical rhinoplasty. Reason being that there's just not enough practice to keep getting it right, and it's a dangerous area now that we know with all the studies and data out there. One of the questions we have is, if you don't like your surgical rhinoplasty, can you have a second surgical rhinoplasty as a correction?
So yes, you can, and it's interesting that's a great question. And the reason why is because there's so many people who get rhinoplasty, and of all the plastic surgery procedure, hands down, rhinoplasty's got the highest dissatisfaction rate.
Yeah.
Now, I don't want to say it's a surgery with that people don't like. I mean, I do them every single day. It's my bread and butter. It's what I love to do. But if you look across the board, of all people who get plastic surgery, the dissatisfaction rate is up to nearly 30% across the board. That's all types of doctors doing it. If you go to someone who's a specialist who does it, it may be in the 5 to 10% range, where someone wants to do it again in the future. And if you go to someone who's really good, does a lot of it, and they know what they're doing, it's 3% or less. So the revision rate can be as high as 30%, meaning people want a secondary procedure. Now, why does that happen with the nose? The nose is so intricate. There's so many tiny little nuances. There's cartilage and fibrous tissue and fatty tissue and skin. And the nose, when you make a small little change, there's a lot of things that hinge on that change. So you have to be sensitive to that. Secondly, it's the breathing. The nose also has a breathing function. So if you make a slight change and you get a little scarring, you can obstruct someone's breathing. It can be a big problem in the future, where they don't care about their nose anymore. They just want to breathe, because it's such a miserable feeling to not be able to breathe. And thirdly, something that people don't often talk about, is the nose is smack dab in the center of the face. When we look at someone, the first place we look is their eyes. The second place we look is their nose. We don't realize we look at their nose second, but we do. The reason why we look at the eyes first is because we want to see, is that person safe? Do we trust them? The wider apart someone's eyes are, the more we trust them. The more open their eyes are, the more inviting they are. Think of a baby. Think of a lamb. We like wide open eyes. We don't like narrow prey eyes. So we look at the eyes first. The second place, we look at the nose. We don't even know we look at the nose second, but we look at the nose second because we're measuring symmetry. Symmetry means health. And that means good genes. So we do this subconsciously. It's driven into the most deepest corners of our brain to look at the nose. So we look at symmetry. Now, if I look at your face center out, you recognize asymmetries in your nose, and we all do in ourselves. But if you have a slight asymmetry out here, if I tell you your ears are asymmetric, you're like, they are? You don't even realize it. Nobody looks at their ears. But if your ears are asymmetric, you don't care. But if your nose has a slight asymmetry, it drives you crazy, because you look at faces center out. If I put a mole on someone's face over here, it's a beauty mark. But if you put a mole on someone's face here, it's unattractive. So the further you out of the midface where there's asymmetry, the better. Anything asymmetric in the middle face is not good. Also, thirdly, cell phones today. Do you know a cell phone distorts the center of your face 30%? Yeah. Noses look 30% bigger in a cell phone. So when someone says to me, look at my face, my nose is too big, I'm like, wait a second, but that's in a cell phone. Yes, but I don't like the way my nose looks in pictures. But that's not the way it looks in real life. So if I make their nose look perfect in a cell phone, then in real life they're going to have a pinched nose and not be able to breathe. So there's a lot going on here with noses that makes it such an area with high dissatisfaction.
That is excellent.
And those cases are revision rhinoplasty. That's when people seek out a revision. Now, it's incumbent upon the doctor to not operate on someone who doesn't really need it, because oftentimes if they go through multiple surgeries, the nose can be a disaster. I mean, many people remember Michael Jackson's nose. Yes. There wasn't much left of it. So you don't want to do too many surgeries on a nose. You want to do less is more. And noses, especially if you're going through a secondary rhinoplasty, you really have to see someone with a lot of experience. It's not someone you go to who's just done a few. You really have to go to someone who's done a lot.
True. And I think one of the things to do is ask for some before and after pictures, and probably ask to talk to patients who've had surgeries with the doctor, right? Isn't that what you would recommend? Because that's what I recommend. If patients have doubts, I'm like, here, this is my patient list. You can speak to these patients.
I think that's a great recommendation, is to ask them about other patients. Now, sometimes there's HIPAA violations or we have private, but you do want to ask them to see other people. I think that's important, or talk to other people, or be able to see before and after pictures. Also, another great question is, how much experience do you have? How many do you do? How many have you done? What happens if there's a complication? Will you be there for me? Will you answer the phone afterwards? Right? Are you available? Do you have hospital privileges to do this procedure? Because that means that you've already been credentialed. You can ask if they're board certified, and that's an important question, but it's not the only
One
question.
of the good questions we have here is, what is your opinion on using a BD syringe to inject the nose in terms of safety? Is the pressure more controlled with a BD syringe as opposed to a regular needle or a cannula?
So I'm assuming they're talking about the
Yeah.
TB syringes, the
Yeah,
really
the
small
small one.
ones, and so that's you're probably injecting superficially. You're probably not injecting deep. If you want to, I mean, you can, but it's harder with that BD syringe. If you want to inject deep into the nose, where you should be injecting, which is below the SMAS, then a BD syringe is not going to be ideal. Now, once again, I'm a strong advocate for cannulas. I switched to cannulas about 8-9 years ago, and I've never looked back. I published a paper back, I think it was 2012, on complications from fillers. And once I learned and realized that it doesn't happen as much with cannulas, I went to cannulas. So I don't use needles anymore in the nose. Once again, there are people who do. If you're using a BD syringe, you may be staying superficial. In theory, if you're very superficial, you're not going to get into one of the large blood vessels and get a major complication with an injection that can go anterior grade or go towards the eyes. But you may get, there's been a few cases of necrosis of the skin with injections of fillers into the nose. It's unlikely. It's most commonly in the tip where you get a pressure necrosis, and it's usually in someone who's had a previous rhinoplasty. So if you're going to use a BD syringe, it's going to be done superficially. You got to be careful, and you want to do it in someone that has never had a previous rhinoplasty.
Yeah, that's good. Another question we have is, when do you choose filler versus an implant for a chin?
That's another great question. So in surgery, as we continue to get better and better at fillers, it's amazing. We're doing less and less implants. I don't think I've done a cheek implant in 10 years. So cheek implants have gone away because I get such better results today with filler, quicker, easier, and I can mold it a little bit better. Having said that, chin implants, I'm still doing some. And I don't know if you know this, Chai, but chin just got FDA approved about 2 weeks ago in the U.S. for Voluma in the chin. So you might start to see a lot more promotion now because Allergan can promote it on label. I was actually one of the investigators in that clinical trial, and we got great results with putting filler on the chin. So it works. And one of the nice things about doing filler is that you can feather it out into the pre-jowl area. With a chin implant, oftentimes it's difficult to treat this area of the chin implant. So chin implants have a difficult treatment here. Now, having said this, I still do quite a few chin implants. Many patients want a permanent result, and I'm able to achieve that with the chin implant. So it's not for everyone, and you're probably seeing more and more fillers. And my hunch is 3 to 5 years from now, we're gonna be like, implants? We used to put those in people's faces, because we'll probably be all using
Probably
fillers.
true, but in India, everything is on label for us: nose, chin, everything. So we've been doing chin fillers right, left, center on label for a long time. And Indian faces generally tend to be retrognathic, so they tend to have a shorter chin and more retruded. So we use a lot of chin fillers here.
You know what's amazing? I don't know if you've seen this in India, but when we treat men, if we give them a chin and they had a weak chin beforehand, the difference is unbelievable. The way they get treated, the way they feel. Many times men will have goatees or they'll wear beards. We put a chin implant in, all of a sudden they walk around without. It's amazing the difference.
It is. And people don't realize that.
And there's studies on this too.
Yeah.
For men, there's trials out there in behavioral psych that I've reported on that show that men who have more dominant features, which is a strong jaw, a strong cheek, strong chin, and strong brow, they get treated better. They may even make more money when they get hired for their first job. There's benefits with with dating and mating that may happen with men who look like that. There may be benefits as well if they're going elected for office. Now, if it goes too much, they start to become scary looking. We don't like that, but making a male face a little more dominant can be beneficial to a man. It's really quite interesting.
Evolutionary, right? Masculine features means more power. I think it just goes all the way back to evolution.
It does, and that's, as you know, I like to write about that and weave that into all my
One
studies.
of the other questions we have is why do people look so stretched when they have facelifts, and why do their features go out of proportion? And we see this more often with celebrities, and when they can afford the best, why is it going wrong?
Wow, that's a great question too. So we see so many people today who are over pulled. Now, some of it, there's a lot of different reasons for it, but in the past, certainly before the 1980s and 1990s, facelifts were done by just lifting the skin, and they pulled the skin. And that doesn't work so well because you get that lateral sweep through here. What's amazing to me is how many women may have that lateral sweep of skin that looks bizarre, and they don't even bother, they don't see it. It doesn't bother them. But you look at them, you're like, oh my gosh, it looks terrible, because they don't see that side of their face. Nobody looks at that side of their face like we were mentioning before. But it's a telltale sign they've had surgery. So then facelifts advanced, and we started going deeper and lifting what's called the SMAS. That's the fibroelastic tissue that surrounds the muscles of the skin. So we pull that back now, we tighten that, and that doesn't give you the same amount of pull that you get from the skin. It's a more natural look. But having said that, when people pull this area and they don't treat the mid-face area, then you start to get this disconnect. This area is tight, the jawline looks good, the neck looks good, but the cheek pad is dropped. So then some doctors started moving forward, doing what's called a deeper plane facelift, and lifting all of this. And then you start lifting all of this. Now, having a lot of doctors do that, and a lot of doctors specialize in that. That's not my philosophy, because I believe that even though those people may look great, you look at the before and after pictures, like, wow, their jawline looks fantastic, their cheeks look great. Something to me still looks unnatural. And what's amazing is humans are so great. We all have this incredible skill to spot unnatural right away. And sometimes we don't know what it is. We just look at someone like something off. And what happens when we see that is we then judge that person as being unhealthy. We don't like it. It's a disconnect. It's uncanny valley. It makes us feel uncomfortable. So even though the person may look like they had a great outcome, and doctors may say, wow, look at this, I got this great outcome. And I can show you so many pictures that are in medical journals of people who are celebrating how to do a facelift, or how to do a rhinoplasty, or how to do eyes the most appropriate way. And I look at the pictures, I'm like, okay, it looks like you got a great result. Mathematically, it's a perfect nose. Mathematically, it's a 5 formula. Or their neckline looks great, but there's something that's off a little bit, and you pick up on it, and I don't think that's a success. So my philosophy has always been to make someone look better, but you can't know they had something done. And I call it subliminal difference, and I've published quite a bit on this, is that you should not be able to tell somebody had something done. If you can tell that they had something done, we failed. We failed. Now, what that means is we're going to be conservative. I may improve this. I tell patients, I'll get your neck band 70 to 90% better. I won't get them 100% better. If you want them 100% better, then you should probably go somewhere else. But if you're okay with a 70 to 90% improvement, I'll do that for you, because if I'm going to get this 100% better, I may force you into a space where you're going to look unnatural, and I just don't think it's worth it. Some patients want that, but they stop recognizing that they look unnatural. It's called perception drift, which Dr. Fabi Sabrina has written a lot about, and Kate Goldie has written about as well. And I think that's something we all have to recognize, that we start to lose track of what looks natural, what looks good to us, when we spend our time around other people who look unnatural. So it's incumbent upon us, and I'm sure you feel the same way, Shai, is to tell your patients, no, it's not going to look good on you if I do that. And sometimes it becomes a negotiation with the patient, like, I really want my lips bigger. Well, no, if I make your lips bigger, if I pull your face tighter, it's not going to look right. But I want it, but you're not going to look right. At the end of the day, you're going to make a worse first impression. So
Agreed.
Conundrum
And
for
I
us.
see this in my filler patients, because now my practice in India is almost 15 years plus. And, people who've been having fillers from the start, they've forgotten how they looked originally. And now they're like, oh, but I think I need a little bit more. And I think my lip corner can go more. And I'm like, no, you look great. And no one can guess you've had anything. You've looked amazing. Oh, but a little bit more. And I'm like, no.
I love that you do that, and I get discouraged when I see someone come back to me. Oh, I went to another physician, or I went to another provider, and they said, okay, come on, the lips look like, and I'm like, I just don't think that they're not going to look. They just don't look good. So, and it's also, we have to do a good job of recognizing that when someone's been overfilled, and even sometimes doctors get lost a little bit in this perception drift. They start to they lose track too of perception. So you always have to check yourself.
True. I know we have like 2 minutes left.
And celebrities of the world, you're right, celebrities go off the. Okay, let's do 5 minutes, because I missed you a little bit beforehand, so I want to. And this is so interesting to me. It's so great to talk to you.
So we have a good question here. They say, do you approach all ethnic noses the same, like Caucasian versus African, or is there any difference when you approach an African nose for a non-surgical rhinoplasty?
So there's definitely differences with ethnicities, and we have to, oftentimes noses that are African or Asian have a low dorsum, so they need that area built up. And I may use a more, and the skin's a little bit thicker, I may use a more robust filler. I use something like Radius in that area, or calcium hydroxyapatite. They also have loss of projection of their nose, and they have a short septum. They don't have a lot of cartilage support to their tip, so the tip tends to go down. So I put a lot of filler into the nose to lift it up to give them a more aquiline or projected tip. And that works well too. I also put filler down along the premaxilla. Right. The premaxilla is the area below the nose, and it lifts the whole base of the nose. And interestingly, it also lifts their lip a little bit, shortens the lip, which is a really nice look. So that I may do in an African nose or an Asian nose, which may be different from a Caucasian nose. But also, what's really important is to make sure I talk to the patient and figure out, what do they want? Are they okay if we alter their ethnicity? Because some people say, I want a nose that looks Caucasian. You sure you want that? And sometimes I get people who want to preserve their ethnicity. What I found interesting in the U.S., and I'm not sure if it's like this elsewhere in the world, is if I meet someone who just emigrated to the U.S., they came to the U.S., they want a Caucasian nose. But if they're second generation, where their parents or their grandparents came, they want to go back to their ethnicity. They go, I want to keep my ethnicity, just make it a little bit better. So I find that interesting.
It's true.
It's a trend I've recognized.
First generation is trying to mingle and settle in and get part of the pool. And so they're trying all of these efforts. I've seen that too. Very true. Now, another question I have for you is, what is the downtime? What should one be prepared for when they go in for a rhinoplasty, a surgical rhinoplasty?
So it varies depending on where you go and what you have done. But generally speaking, my patients expect we tell them a week of downtime. And really what that downtime means is they have a splint on their nose. Now, can they walk around? Yes. And I'm sure if I walk around Chicago right now, I'll run into a patient or two who will walk around with a splint on their nose. I did surgery on them this week because they're visiting Chicago and they want to see the city while they're here. So you feel pretty good after a day or two. And today, there's very little bruising and swelling. So most of my patients, I do something called endonasal rhinoplasty. They make incisions on the inside. That's my preferred technique, and it's minimally invasive. And patients tend to heal faster with less swelling, much less bruising. And it's their nose, which is better. And it allows people to get back to their normal routine within a week. Exercise, I say maybe 2 weeks. But I mean, also, the nose takes a really long time to heal completely because it gets smaller and smaller throughout the year. But within a week or two, most patients are feeling pretty good back at their normal routine. Whereas filler rhinoplasty, they go back the same day, though. Right? If they walk out the door and they're like, wow, look at this. They love the results.
That is true. That is true. And they love the immediate result way more than the 2 week later result, depending on the filler, rheology. Yeah. So tell us a bit about the neck. I mean, we talked about the face, right? But we always see people get their face done. It looks great, but they forget to do their neck. What's with that?
Yeah, well, we're seeing more and more emphasis on the neck now because people are starting to say, what can I do for this? And some of it is that we didn't have a lot of good solutions. Facelifting was really the only solution until most recent, probably in the last 5 years, we didn't have much else to do. And many doctors didn't want to do a facelift, or even sometimes if someone's got a lot of crepey skin, a lot of thin skin, even a facelift, you pull it back, it's going to rebound. It's not going to look good. So there weren't a lot of solutions. But today now we're doing things, neurotoxin can reduce some of the banding of the platysmal muscle, and it's now currently in FDA trials. There's radio frequency treatments that can be done underneath the skin to tighten it. There's ultrasound treatments like Althera that can also work to tighten it. And then there's CO2 laser some people do. There's PRP. There's filler. So there's so many ways to treat the neck today that we didn't have a while back. But I will say that I believe that the non-surgical methods are so much better for the upper part of the face. I believe the neck is the last area we still have yet to conquer non-surgically to really make a significant improvement. We're getting there, and I think that a generation from now, medical students are going to say, you used to cut people? I mean, like, you cut them open to make their face better? How did you do that? Why would you? That's so barbaric. So I think we're getting there. I think it's going to be another generation before we got it down, but soon we're going to get the neck to a point where people may not need surgery anymore, or very few people will.
That's great. Now, Stephen, can you give advice to some of the younger dermatologists and plastic surgeons who are watching you today as to how they have to constantly keep training or innovating and what they can do to keep bettering themselves over the years?
No, it's a really good question. It's really important. Of course, as a doctor, most of us inherently are curious. Otherwise, we wouldn't be in this field, and most of us are altruistic, or else we wouldn't be in this field. So it's important that you keep learning and training yourself. Of course, we all we follow up the CME and the courses, but you have to not be afraid to follow your own vision on this, and you may think something's different. You may think what you're learning from your professors doesn't make sense, and that's good. And explore on your own where you think it, because you're going to do a treatment, you're like, that's not really the way my professors taught me, or I'm getting a different outcome. Explore it, and you'd be surprised where your curiosity will take you. So I'm always encouraging my fellows and residents to be curious, to find new ways of doing something. If you create something that's based on an insight that you recognize in the clinic, and if you follow that out, study it. If you can study it, great. If you can do a little clinical trial, do a clinical trial, and you're going to see that as you do this, you're going to start to develop your own style, your own little piece of area where you are discovering and you get interested. I became really interested in the behavioral psychology aspect of plastic surgery and talked about the importance of the psychosocial aspects, like how many people feel, when I started realizing that people even with perfect results weren't happy. And sometimes people who didn't have perfect results were super happy. I started recognizing there was a disconnect, and that the great result didn't necessarily mean a really happy or successful outcome. So I started changing the success of my procedure to the satisfaction of the patient instead of to the mathematical perfection of the face. It wasn't about the physical, it was about the emotional.
Right.
And self-esteem. So then that took me down a whole nother lane of thinking and writing and teaching that expanded my world and has made this field so incredibly exciting and fun for me. And it's so different than the way when I came through 20 years ago, we were told how to make a perfect nose, how to make a perfect face. This is how you cut. And it's now a completely different field. And I'm so glad for that. And aesthetics allows you that. I don't know if every field in medicine allows you to do that, but aesthetics has that creative aspect to it, that entrepreneurial aspect to it, that allows you to grow and think in a different direction, and it welcomes it. So I say good job for being in aesthetics, and follow your passions and follow your thoughts, and you'll be amazed at where it'll take you.
I think that's great advice, because a lot of plastic surgeons and young dermatologists are always wondering, and sometimes they get a little held back to say, oh, I don't agree with this, or to say that, do you think we could try this? And I think you're saying that don't be scared is amazing, because I think that's what it is. And I think I first met you at one of the congresses where we were on a co-panel, and you had all of these thoughts which were very abstract to the subject right there, and I thought, my gosh, this guy's amazing, he's so innovative. So what is this? Was this always like this, or this is something that you habituated?
Well, I studied philosophy and religion in college, so it's always been back there with me, and so I always look to those things. I think there's multiple ways of looking at the truth. I don't believe the truth is just from science. I think science is just one prism from which you look at the truth. I believe philosophy, religion, I believe traditions. There's many ways, many different views of the truth, and your truth might be different than my truth, and I think that's good. And we can't. And I think we get narrow-minded when we think all we're going to do is read a peer-reviewed trial, and that's going to be our result, and that's going to be our answer, and that's going to be our truth. So I'm always saying, I never thought of it like that way, or can we look at it like this? And then I started teaching a class, undergraduate class, at a university in Chicago. I teach medical school, but I started teaching undergraduates on the science of beauty and its impact on culture in America. And it was a great class because when you take young minds, they're so fertile, but they're so opinionated. So they would come in saying one thing, and I'd be like, well, did you ever think of it like this? And it would lead to these great discussions that were very, very explosive, but it was a great way to expand their minds. And then that led to me writing a book about this called Subliminally Exposed, where I spent 4 years traveling the world trying to figure out what we all have in common. Many people see differences, but I see more similarities than differences. People from India, from Asia, from the US, from North America, South America, what makes us all the same? That's what I'm interested in. And then when you start to see that we're the same, well, we all evolve similarly. And we have these biological amygdalas that are deep down in our archaic brain that all like the same thing. We all like, there's a reason why sugar is sweet. Why is sugar sweet? There's a reason for it. There's an evolutionary reason for it. Mother Nature doesn't make mistakes. When we start looking at things from a Darwinian perspective, it just started becoming so clear to me, and it becomes fun for me. And now I follow the philosophers, and I always try to when I write today, I try to weave in the way that these philosophers think, and I try to weave in religious tones and themes, and it makes plastic surgery so much more rich. It just makes it so much more deeper, and you really start to get a larger picture of what we do and why we do it. And
That's
that's what I like doing. It's my
That's
passion,
great.
as
That's
you know.
great because it keeps you like I think it keeps one very motivated and it always keeps you like looking for what's next, right? You don't get stagnated in your life. And I think that's especially important if one has to keep improving upon themselves.
You also become a better doctor because you start to think a little bit differently and better. And I think you should look at it from the patient's perspective. And I really think it makes me a better doctor than today. And I think that's what makes me successful. If I try to be like everyone else and do what they do, I don't think I would be successful. It's that I can think a little bit differently. So I encourage people to do that. If others are doubting you, questioning you, then you're doing a good job. So I always say push the envelope, push the boundaries, know where the boundaries are, but push them. I have some students with me yesterday. So in my office, I have framed some of their criticism and rejections from a bunch of my articles I wrote in the early 2000s. And I always framed them because I said one day these articles are going to be accepted. Now, of course, I get invited to give keynote speeches on these topics, but at one time it was thought to be rogue to talk about these things, and that's good. So whatever you think people are doubting you, mark it down, keep track of it, because if you're so confident, so sure, you'll see, it'll come around.
Oh, fantastic. Thank you, Stephen, for joining us today. That was a great session because you had such great tips about rhinoplasty, which we had a lot of questions about. And like you said, it's one of the ones that procedures that people have more unhappy quotient about. And also for all those encouraging words to all the younger dermatologists and plastic surgeons. So stay safe, stay healthy, and we'll see you post-COVID. We'll definitely catch up.
Thank you so much. This was so much fun. I have to tell you, I do a lot of these. You asked some of the best questions I've been asked ever. Your questions are great. You have a future in this.
Thank you.
If you want.
Thank you, Stephen. We'll see you soon, maybe on my own podcast or TV show. Bye. Bye.
I look forward to it. We'll see you
Bye.
soon. Bye.
So that was Stephen Dyan, who joined us all the way from Chicago to talk to us about his specialty in facial plastic surgery, a little bit about the facelifts, and mainly about rhinoplasty, which is one of the most difficult procedures to get patient complete satisfaction on. And of course, his pearls of thoughts about us not being fearful and striving to be better. Thank you for joining us today, and we'll see you next week for our Insta Live sessions. Stay safe and stay healthy.